weeks pregnant, you probably have a lot of questions like how your baby is developing, what to expect at your next OB appointment, what common symptoms you might be feeling right now, and what you can do about them. And we're going to talk about all of that and more right now. But first, if you're new here, you're watching the Health and Medical Zone. That means being in good health and good spirit. So if you like being healthy and happy, go ahead and click subscribe because you're in the right place. So you are 24 weeks pregnant, which means you are now 6 months along, and you only have 4 more months to go. And if you like to count by weeks, that means you have just 16 weeks left. When you look at it that way, you can really see that you're getting close and that there's still a lot to do before you bring that baby at home. Right now, your baby is about 11.5 inches long from head to toe, and they usually weigh around 1.5 pounds. They're continuing to develop more fat under the skin, which helps your baby look more like a baby on ultrasound. This also makes the skin appear less transparent and pinker. Your baby now has eyelashes, eyebrows, and hair on their head. But that hair doesn't have pigment yet, so it often looks very light, or even white. The pigment will start to show later on. Your baby's hearing is more developed now. They can hear not only the sounds your body makes, like your heartbeat and your stomach noises, but also sounds from outside your belly. So you can talk to your baby, sing to them, or play music. They can hear you, and they're starting to get familiar with their mommy's voice. Your baby's movements are also getting stronger. Up until now, you've probably been the only one enjoying those movements. But at this point, someone else may be able to feel the baby move by placing a hand on your tummy if they're patient enough. By now, your baby is learning how to do practice breaths, breathing in and out amniotic fluid. This helps strengthen the muscles and prepare for breathing on their own after birth. The lungs are also starting to produce something called surfactant, which helps keep the tiny air sacs in the lungs open when the baby breathes out. This is extremely important once your baby starts breathing air after they're born. Week 24 is considered the age of viability. I talked a little bit about this in week 23, where I mentioned that if a baby is born at 23 weeks, there's about a 1/3 chance of survival. And out of that 1/3, around 60% of babies may have some degree of severe disability. At 24 weeks, the survival rate doubles. It increases from about 33% to around 60%, meaning that more than half of babies born at 24 weeks can survive. There is still a high risk of severe disability, about a 50% chance. But because survival is now over 50%, this week is considered the age of viability. Of course, you do not want to deliver your baby this early, and if you were to go into preterm labor at this point, your doctor would work very hard to try to stop labor. Most OBs like to see you around 24 weeks, and this is often when they'll do your gestational diabetes screening test. This test is usually done sometime between 24 and 28 weeks. It's a blood test that's drawn after you drink a large amount of sugar to see how well your body is able to control your blood sugar levels. Most of the time, they'll give you a bottle of a sugary drink to drink before or during your appointment. It tastes like a really sugary, flat Sprite. It's not great, but it's not terrible either. If your blood sugar levels look good, then you pass the test and you don't have gestational diabetes. If your blood sugars come back high, they may have you come back for another test so they can take a closer look. If you are diagnosed with gestational diabetes, your OB may recommend a special diet to help control your blood sugars. or they may have you take insulin shots. Keeping your blood sugars under control during pregnancy is really important. High blood sugars can cause your baby to grow too large, which can make a vaginal delivery more difficult. And after birth, your baby may have low blood sugar levels. If you do have gestational diabetes, it does not mean that you will have diabetes after your baby is delivered. However, studies show that women who have gestational diabetes do have a higher risk of developing type 2 diabetes later in life. So it's just something to be aware of. Another test your OB often orders around this same time is something called a CBC, which stands for complete blood count. This test looks at several things, but in pregnancy, they're often checking for anemia. Anemia is fairly common during pregnancy, and if you have it, your provider may recommend that you take an iron supplement to help manage it. If your OB or midwife suggests that you start taking iron supplements, just be aware that iron can cause constipation. Because of that, you'll want to stay ahead of it by making sure you're getting plenty of fiber in your diet. Foods like vegetables, fruits, beans, oats, and quinoa can be really helpful. I haven't talked much about leg swelling in my earlier videos, so let's talk about that now. Not everyone experiences leg swelling during pregnancy, but most women do, about 75%, and it can start as early as 22 weeks. It doesn't happen at the same time for everyone, and it can be different from one pregnancy to another. Ankle swelling happens because of extra fluid that pools in your legs, ankles, and feet. During pregnancy, your body makes extra fluid and extra blood to support both the pregnancy and the delivery. It's also not uncommon for swelling to be worse during hot weather or if you've been standing for long periods of time. You can help reduce swelling by walking regularly, elevating your legs above the level of your heart, and, if you're able to, wearing compression stockings. Your OB can write you a prescription for them if you want, or you can purchase them on your own. I recommend getting the kind that go above the knees, the thigh-high ones, rather than the ones that stop below the knee. Now here's something you really need to be aware of. Swelling in both ankles is considered completely normal during pregnancy. However, if you notice swelling in just one ankle or one leg, that is not normal and could be a sign of a blood clot. A blood clot in the leg can travel to the lungs, which is called a pulmonary embolism, and that can be life-threatening. So, if you have swelling in only one leg or one ankle, you need to get it checked out right away. You'll also want to watch for pain in one leg or redness or warmth in just one leg. These can also be signs of a blood clot. Now is a good time to start thinking about your maternity leave if you're working. Look into what maternity benefits you have available so you can start planning ahead. This is also a good time to begin thinking about prenatal classes. You'll also want to start preparing your home for when the baby comes home. A lot of times, this happens naturally without you even realizing it. It's called nesting. We naturally want our homes to be clean, organized, and baby-proofed. And now is a great time to start, while you're still feeling good, have more energy, and your belly isn't too big yet. You'll also need to start thinking about where your baby is going to sleep. The American Academy of Pediatrics recommends that babies sleep in the same room as their parents for the first few months of life. This is safer for your baby and also easier for you, since you'll be getting up frequently during the night to feed them. For those first few months, you can choose a crib, a bassinet, whatever works best for you, but they do not recommend bed sharing with your baby. As far as other pregnancy symptoms go, I've covered many of them in my earlier second trimester videos. So if this is your first time on my channel, I highly recommend going back and checking some of those videos out. If you're spending time outside, Using a spray mist can help keep you cool. Wearing comfortable, loose-fitting clothing is also important, and dressing in layers can help, so you can remove a layer if you start to feel too warm. Thank you so much for watching.